So we were very nice talks about like how to select patients while knowing about like how to do a tomography or reading a tomography, and then from Dr. Monet, Shakir, and Kishore, and then an excellent presentation about Smile Pro. I'm just going to talk about what happens when the nightmare comes alive, like what happens like when we start seeing problems, because until unless we are really familiar how to deal with them, it might be like very difficult to get over with the fear of unknown. It's about one of a patient who actually had LASIK done quite some time back, and while she was opening her car door after shopping, something struck in her eye, and following to that, she started developing irritable eyes. She went to the she came to Pakistan actually and went to the optometrist, and this thing was noted. She was referred to us for further management. On slit lamp examination, what we found was an inward turned flap. This is something like 7 years down the line after refractive surgery. So a few more images, we can see the flap intern. Here we could also see a line of epithelial ingrowth and inflammation of keratitis being present. So what we did was lifted the flap, washed it, and placed it back. And it's a simple thing. Once you're experienced in lifting a flap, just take care that when you're lifting up the flap, then wash it properly so that epithelial ingrowth can become a problem later on. This is another patient who actually had a burning sensation, sticky eyes. This is a post-LASIK patient, femto LASIK patient, who actually presented to us, has been treated with quite a number of medicines and things, and when we saw it in a slit lamp, they were like small tiny deposits of adenoviral keratitis. It's not visible in here. It's just when we did a pentacam, corneal densitometry, we could see all those things. Now, they are treated as normal adenoviral keratitis spots, and when treatment applied, these disappear quite quickly. But one has to be on guard, because if these things are left for longer, they can become permanent or even get more aggressive, and life can be quite disturbing, especially driving becomes a little more irritable. Another patient who presented to us 6 months down the line post-PRK, complaining of blurring and halos, and on eye examination we could see a haze in the cornea developing. Pentacam corneal images shows a specific centerized corneal haze. Steroids and cyclosporins we prescribed, and following to the treatment, it disappeared, but it took something around like 2.5 months for this thing to get settled to this stage. But as soon as we stopped, it started repairing again, and then we had to restart the treatment, and we had to continue it on for almost 4 months' time. And the 28-year-old female who presented 2 days. This is for the beginners, but I think the experienced surgeons have seen it quite normally in the clinics, and they are very well aware of it. And when such a thing comes in, it is treatment to be started as early as possible. This is diffuse lamellary keratitis, and initially it can be started as steroids, but if it is coming into the center area, or like you see scarring coming up, it's better to lift the flap and wash it. Same treatment was given. Actually, in this case, we were very lucky to get away by only prescribing steroids for a longer time, and things settled in very well without having any effect on to the visual outcome. Another interesting thing is like we should always be on a watch out for a raised intraocular pressure. because prescribing steroids, we do find steroid responders, and they can like present within 24 hours or a couple of days even. So one has to differentiate, especially whether it is because of a raised intraocular pressure or a diffuse lamellar keratitis. This is like very important, because one would require steroids, and the other one, if we prescribe steroids, it might make a mess out of it. So thank you so much. Thank you for the time.
Ready?